Hi everybody, this is Dr. Mario Wallace, and this is part 2 of my discussion on how to make the doctoral study more practical and accessible for business owners in the United States. Before we get started, make sure that you subscribe to my podcast by clicking on the link below and turning on your notification. In part 1, I explained how to organize the emergent themes into a sequenced emergent theme model. In this video, I will explain how to strengthen the model by pairing management tools with the model to help managers effectively apply the model to business practices. So if you look at the screen, you see the Sequenced Emergent Theme Model with 3 emergent themes. At the base of the model, you see, or the foundation of the model, you see environmental scan. Next, you see strategic planning. And lastly, you see risk management. Now, it is structured this way because this is the order of operations for this particular approach. You must have environmental scan at the base, because before you can develop a strategic plan or look at a strategy to determine its strategic risk, you must study the environment, the market, to know exactly what your competitors are doing, what changes in the market, what government has done as far as writing new policies or new bills. Also, what new technology is driving the market today, and based on the information, you can begin to build a strategic plan, identifying your vision, your change agenda. What changes will you make within your organization? What objectives, measures, targets, and initiatives? How do you execute your strategy, and how do you manage your strategy over the life, the strategic horizon of your strategic plan? And lastly, you have risk management. Based on your strategic plan, you need to be able to identify risk within your plan. So this is why risk management is the last step of this actual sequenced emergent theme model. One thing that we have to always realize is that all strategy, the best strategies have risk, have risk. And we have to be able to identify risk within the plan to ensure that we build mechanism for mitigation and contingencies in case our strategic path that we plan to travel on, if it gets disrupted, we have contingencies to help us get back on our path and move the organization forward. So the goal now is, how do we strengthen the sequenced emergent theme model, And if you look at the screen, you would see the emergent themes within the model, starting at the base of the model again, environmental scan, then strategic planning and risk management. But if you look to the right, you will see different management tools that you can use to actually help managers apply the model in a more easy way for them to be able to really understand what they're doing in the application process. And if you look to the right for environmental scan, you see the Pest Analysis, which is a model, a strategic management tool that has been around for over 40 years. It's very effective. It looks at the market from 4 different factors, and that is political, economical, societal, and technological. And within those factors, you can definitely gauge what's taking place in your market. Then you have strategic planning, and the model that's used, that I paired with strategic planning, is the ADAM strategy management model, which looks at how to manage a a strategic plan within 4 phases, and that's analyzing the market, again, developing the plan, executing the plan, and managing the plan. And lastly, you see the risk management model, which actually looks at which objectives or initiative within the strategic plan that has risk. What is the risk event? What would this risk cause the organization? What is the category of the risk from 1 to 5? And lastly, what are the action plans as far as the mitigating strategies and the contingency plans? So the first model is the pest analysis, which aligns with environmental scan. And if you look at the screen, you see the 4 factors that are associated with the model, which are the political, the economical, the societal, and the technological. So what the information I have populated within the model is for healthcare. It's directly related to healthcare. And so when you think of these 4 factors, when you're trying to conduct an environmental scan, especially if this is healthcare, you think the first thing, the highest level of government who are passing bills and who are writing federal policy, you think of the executive administration. Then you can think of CMS for Centers for Medicaid, Medicare, and what are they doing? What new policies have they implemented that affects healthcare in a way? Then you can also look at, from the economical perspective, you look at what models are driving the healthcare industry, such as is it fee for service or is it value-based care? And if it is value-based care, there's other factors that can strengthen that particular model, which is based on how do you add value to the patient. So it's more about patient than it is quantity. So different affordable care organizations, ACOs, have what type of partnerships can we align with those ACOs? Are we a part of an ACO? What type of PCP, primary care physician referral structures do we have that are robust, that can help in our referral process? And also, when we think of, and should those referrals come from, so should those referrals come from local partners within our town, within our city, within our rural community, within our region, from health systems like critical access hospitals, or within urban communities like hospitals or acute hospitals or academic medical institutions? Those are things we need to consider when it comes to the economic factor of our market analysis or environmental scan. When it comes to societal, as a health organization, we need to think about, do we notice population shrinkage? Are people leaving or migrating away outbound, or are they migrating into? We need to consider, what are the ages of that population within the next 1 or 2 years? Do we see an uptick in people who are going towards retirement? In underserved population, does that exist within our population? And if it does, is there something that we need to start looking at? Is there opportunity there? And lastly, when it comes to technological, do we see trends toward different technologies? Do we have a shared service approach? Are we integrated into other healthcare systems within our town, within our city, within our region, or within our state? So you can see a full cycle of care as it relates to healthcare. Do we practice e-therapy? Do we have some type of wearable, I know I'm pronouncing that incorrectly, or any type of biosensor devices that can actually communicate health outcomes from the actual patient to an EMR system, electronic medical record system? And lastly, are we using any type of apps that are available today that associate with any type of health concerns or health conditions of our population? The ATOM model, strategy management model, is associated with the emergent theme strategic planning. The ATOM model looks at the full cycle of strategy. So it's considered a strategy management model. It looks at the phase of 4 phases. So one is analyze, the other is develop, execute, and manage, right? So we think of the analyze phase, we go back to the pest analyses. That information can be, some of that information at the highest level can be transferred from the pest analyses to the ATOM strategy management model in the analyze phase. But once the market has been analyzed, we have to allow executive leadership across the organization to look at the results of the pest analyses and give feedback through executive interviews. Then we have to allow mid-level management to look at it through structuring some type of not a town hall, but focus groups. And then when it comes to the entire organization, we have to allow them to look at data from executive interviews and the focus groups to give their feedback in a town hall setting. So this is important because it helps to reduce the level of resistance from employees within the organization if you follow this path. Now, after this has happened, the next phase which is the development phase. In this phase, you should go, this is when you getting ready or prepared to go to a retreat. While at the retreat, you should consider what is, based on all this information, what is the new direction? What is the strategic vision for the organization? And once you settle on a strategic vision with the people at the retreat, then start to developing the objectives, the direction of the organization. How do you plan to measure those objectives with measures and targets, and what initiatives, what strategic initiative or projects you need? Initiatives have start and end dates that will drive the measure towards the target. And after that happens, you return from the retreat and you start to look at the organization on how do we execute the strategy. And one thing, if it's an organization with multiple locations or multiple units within one location, you need to strategically align those units, right? So basically, you take the strategic plan and then the objectives, and you start to associate or pair those objectives with different business units within your organization. And then you consider what we call a personal scorecard. You take the people within the organization and you align them with the objectives of the organization or of the business unit that's aligned to the actual main strategic plan of the organization. That will help them with knowing their expectation, setting expectation for them, as well as giving them something to come to work for, something to drive them, something that motivates them. And it's also used for employee reviews, because within their own personal scorecard, they can see where they're hitting their targets and where they're not hitting their targets. So they manage themselves. And also, and the next part of this execution is risk management. So the functional managers who are directly closer to the people within your organization need to start considering, how do they use this? How do they manage risk within a strategic plan? Whenever there is a new plan, there will be risk, because you're taking people out of their comfort zone and you're giving them something new, right? And lastly, is communication plan. So develop a communication plan to drive the outcomes of the strategy. So based on every strategy review meetings, you need to have some type of plan that captures that information and communicates that information out to the public. Also, lastly, is management. So develop some type of scheduled meetings for initiative review, to review all the initiative, Strategy review to review all the entire strategic plan, and strategy refresh to review the entire strategy once a year. That means that look at it, study the market again through an environmental scan, through a pest analysis, and make sure that it's the strategy is still strong enough and still can influence your market or guide and direct the market. So the last emergent theme is risk management, and I've paired this with the risk management model. If you see across the top, you see objective, initiatives, risk events, ranking of the category of the risk. Action is the mitigation strategy, and the last one you see when you say mitigation, that's more of a contingency plan. So what we have to do with this particular model and how it directly supports this particular emergent theme is it's designed for you to look at your strategic plan, look within the strategic plan, identify risk within the plan. Risk can be within an objective or within an initiative, right? Initiative is a project that has starting end dates, time bound, managed by someone, and is associated with a budget. That is what makes it a strategic risk. If it's not associated with the budget, it's just an initiative. Okay. It has to directly support the strategic plan. So this is healthcare, and as you see, I have the first an objective could be transitioning from fee-for-service to value-based care, and with an organization having like 80% fee-for-service and 20% value-based care. And if that's the case, there's definitely risk, because if the strategy is hinged on the transition, and the revenue will come from the value-based care model as we transition for reimbursement from the federal government, then we definitely have to provide some type of training, some type of education. The risk event is the lack of training and education will affect us where the organization would not be able to effectively transition into a more value-based care model. And since if this is a strategy, an objective within your strategy, and you're 80% fee for service and 20% value-based care, is definitely a 5 in category ranking from 1 to 5. It's a high risk for your organization. Now, mitigating strategies could be to train and train and train, bring in professional trainers to continue to train and educate healthcare professionals, healthcare education, and train and educate the staff and medical professionals. And if that doesn't happen, if you see you're trending within, if your strategic horizon is within the next 3 years, and in year 2 you've increased by value-based care by 10%, and it's a 5-year strategic plan, you're never going to get to 50 or 60%. You need to start making leaning towards your mitigating strategies, which you actually write. Once you identify risk in the category, in the risk event, you actually write the mitigating action strategy and the contingency plan then, not after you get into the trouble. Okay. And if your transition is slow, then you probably need to start thinking about, well, we need to maybe recruit people who've worked at hospitals or academic medical institutions, who understand a value-based care model, and can help transition us to value-based care. So you can see that the Sequenced Emergent Theme Model paired with management tools is an effective way to help managers, business managers, or small business owners apply your results of your research, of your doctoral study, to business applications, to their business in an easy way, because they can follow a sequenced order, which is from 1 to 3 to 1 to 5, which is very easy. And they also have different tools that you can provide them with maybe a little training or some instruction on how to use the tools, to help them along the way so they can be effective in their application. If you're a doctoral student and want to learn more about how to create practical models or a sequenced emergent theme model, then reach out to me at Mario Wallace on LinkedIn, the same on Instagram, and Mario Wallace on Facebook. And if this video sounds like a fit to you, please click the subscribe button below, and I will see you in the comments. Peace.